Mental Health Monday with Mick Coyle.
Radio City Talk.
Thanks to everybody who offered feedback on this week's Mental Health Monday guest. Kevin Ellison, professional footballer, just signed a new contract with Morecambe FC and sharing his emotional and mental health journey as well as his physical health journey on this week's show. Loads of great feedback. Thanks to everybody who got involved on social media. For Mental Health Extra this week, we're going to be hearing about a award-winning service, which we've spoken about on the programme before, but they've just had a regional gong, where we thought was certainly worth flagging up and reminding people of the great services that are on offer through the live rooms. We've got Michael Crilly with us in the studio, Director of Social Inclusion and Participation at Mersey Care. Michael, it's great to see you. How are you?
Really well, thanks Mick. It's good to be back, thank you.
Congratulations on picking up a regional gong in the NHS Parliamentary Awards.
Yeah, absolutely.
Tell us how they work.
So the Parliamentary Awards were set up to recognise all that's good in the NHS: innovation, responsiveness, people-centred care. So we this year were nominated by local MP Luciana Berger in the Excellence in Mental Health category. We are delighted to have been awarded the Northwest prize for that category, and that now means we go to the House of Commons on the 10th of July because we're shortlisted for the National Award for Excellence in Mental Health Care.
Is that a posh do?
I hope so.
Sounds like a posh do, doesn't it? And in terms of the, do you know then regionally what you're up against?
Yeah, there are a number of fantastic services around there doing the very best of mental health care, supporting people on the front line, individuals who've done fantastic work with children and young people services, a whole host of really strong contenders. So it's just fantastic to be included amongst your peers in this way.
For people who don't know the phrase life rooms, you've spoken to me about the way that life rooms work and the success that you find through it, and the expansion that you've had of it. We'll come on to the expansion. Tell us the idea first.
I guess the idea for the life rooms really is user-led. It comes from the people who are on the receiving end of our services. You know, for a long time, people have been telling Mersey Care that it's great to get the very best clinical care you possibly can. But one of the things that really impedes people's recovery is that journeying back into life and society, and the real challenges that they very often face to claiming a life of their very own are those social factors. So access to housing, navigating financial matters, navigating the benefit system, access to education, meaningful occupation, social isolation. These are all the factors that, so many of us take for granted. But actually, for many people living with an enduring mental health condition, it's the make or break as to whether or not you get well and stay well.
Do you think that was a leap when that leap was taken to sort of go, well, you know what, there's almost this element of social work which goes into someone's mental well-being, but actually in doing that work, you then take pressure off different aspects of the NHS or prevent somebody maybe needing to return to NHS services later on in life?
That's definitely the aspiration for Mersey Care and our board. Our board is very much signed up to the reality that we should be the National Health Service, not the National Illness Treatment Service. So if we can actually wrap around the very best forms of social support to our communities, the people we're there to serve, then the chances are we can both support recovery faster and help people stay well, but perhaps even more important, we can get further upstream and prevent an almost inevitable decline into crisis for a large number of people. That's got to be better for the individuals concerned and their families, but it also has an impact to the public purse. For us, this is a real opportunity at Mersey Care to re-engineer the conversation about how mental health care is shaped and delivered. And we're particularly pleased that innovation is part of why we've been recognised in the Parliamentary Awards.
And the fact that people can just pop in and have a chat and have that conversation without a stigma or a judgment around it, a safe environment, but also a community environment as well, has obviously sort of played out, because I've got a figure here for the number of visits to Walton and Southport, 2 sites, since opening, and I'm looking at the figure of 34,000.
Oh, it's a lot more than that now. A lot more now. We've been open now in Walton for just over 3 years, and we now have 3 sites, Walton, Bootle and Liverpool. And the most recent figures across all 3 sites is that we've had 100,000 contacts.
Right.
So some people are coming back again and again, but that's 100,000 individual interactions plus, where people have come just to build community, to find relationships, to find more formal groups of support for for mental health, to access learning programmes around their recovery and their well-being, or our social prescribing service, our Pathways Advisory Service that we operate.
There you go. So there you go. Trebled the numbers since
Since
this press release was written. There we go. That's how good you are. You mentioned there Bootle. Just tell us about that, because people might have heard of the Walton and Southport sites. Bootle, though, you're on is it the Hugh Baird College campus?
We're part of the Hugh Baird College campus. We're really excited about this. Bootle is the most recent of the Life Rooms family, and we opened it in January of this year. So it's part of a partnership between us and Hugh Baird College, looking to address student mental health need as well as community health needs, but also to look at improving life chances for the community, helping people to access education and employment. So we bid to the Combined Authority, to Liverpool City Region, jointly for 3.9 million capital funding, which we won, and that has helped us redevelop the site of the former St Winifred's Roman Catholic Church. And so the church has been developed by Hugh Baird as a health education and training hub, so that offers a range of vocational routes through to healthcare professions. On the site of the former presbytery, we built a brand new, beautiful Life Rooms that is now cresting about 1,000 people a month coming through our doors, seeking our support. But we believe that partnership between an educational organisation and a healthcare provider is probably pretty unique nationally. I
get a sense with the service that you offer there, the drop in nature to it. There's a lot of people talking about things like, the crisis on the high street. And it's actually interesting there that you guys at Life Rooms and through Mersey Care are actually offering a potential, solution to, your empty shops and things like that on high streets, which a lot of people walk past and a lot of people would see and engage with. And actually, you're finding that by moving into community spaces that people would naturally move to, be it by the library at Walton or Hugh Baird College, based up in Southport, the people are engaged to drop in. And actually, I think there's almost an argument that says that can be the future of town centres and high streets, that as well as a butcher's and a pharmacy and a shop, you might also have, a Life Rooms type place where you can go in. It can be the community work, it can be the mental health side of things as well. You can grab a coffee in there, relaxation space. That might be part of the future of the British High Street for years to come.
I think we'd like to think so. I think fundamentally this is based upon a premise that building community is in itself healthy. And that actually, if we can get into the hearts of communities, into centres of communities that are already in spaces that are already acknowledged as being the heart of the community, then we have the power to actually support individuals and groups to take ownership of that local area. Because each of our Life Rooms, there's a sort of a common philosophy across all three, but they're all uniquely responsive to the communities that they're in. Southport's, it's just off the high street. Walton's more of a residential area. Bootle's at the heart of a further education college. You've got an opportunity, I think, to revitalise communities in a way that you're not doing to the community. They're actually the ones driving this. We're not parachuting ourselves in with a massive, massive entity. We're just seeking to be a cog in an existing community that helps it function more effectively and happily.
Obviously, doing the show I do, a lot of people sometimes say, who should or where should we go? And sometimes there are different things you can sort of signpost people to. But the Life Rooms is a great one, particularly if they say they're from the areas that you've mentioned, because it does have that kind of drop-in nature to it. Because sometimes people are like, I don't really know if this is like a doctor's thing, or I don't know if it is an issue I need to speak to somebody about. And actually, one of the services that you offer is that thing of, you can kind of go, look, am I in the right place for this? And you can have that conversation. And if you think, well, yeah, you're in the perfect place for it, then great. But the signposting is there for other services if they're required too.
And I think that's really important for a huge number of the people that we deal with. They're sent to one place, then they're sent to another, and then they're sent to another, and they really begin to despair. Our approach in the Life Rooms is that there is no wrong door you walk through. You're a human being. You have a support need. We will do exactly what we can. And yes, signposting is part of that. Some of our internal provision is part of that. But I guess what we do that is maybe a bit more dynamic is that actually we're sitting down with the individual, recognising the individual as their own primary strength, their own major asset. And then we're working with them to co-produce a social prescription or a pathway that helps them access the life they want to access. So it's much more of a dynamic process, I guess, than just signposting.
We've got Michael Crilly with us in the studio, the winner of the Excellence in Mental Health Care Award, sponsored by the Premier League for the Northwest, for the Life Rooms Mersey Care, the Life Rooms through Mersey Care, and they've got a new centre opening up at Hugh Baird College. What sort of ages are you dealing with through the centre at Hugh Baird?
With the community, it can be any age, absolutely. In terms of the college profile, they've in excess of 5,000 students, predominantly aged between 14 and 25, although there's a large range of adult access learning programmes. What's particularly striking about Hugh Baird, and indeed all further education colleges, is that actually that year on year, the massive pressure on their student support services around mental health and students who are declaring a mental health need is staggering. And the real opportunity for us in terms of working with that demographic is very much more the prevention. You know, a lot of what we've learned is supporting people back out of crisis, but we absolutely believe if we can build community, if we can build resilience, we can give people the tools to manage their own health and lives, then we can get there and prevent that crisis and that stretch on services.
What do you see as the offer to those young people, those student age people who might sort of look at the door and think, is that going to be helpful to me? What's the offer that you offer to those exam stress and the whole sort of things they might be dealing with within college life, plus, you know, the pressures that can appear on people for various different reasons, mental illness and so on and so forth?
You know, I think exam pressure, just general living, caring responsibility, confidence, anxiety, self-esteem. It kind of doesn't matter what age group you deal with, actually. Confidence, anxiety, self-esteem are major facets of people's experience. But I guess the offer is, for us, as in any other life rooms, is dictated by that community itself. So a huge amount of work has gone on with us, our team, working alongside college staff, but most importantly of all, working alongside students within the college setting to find out what it is they need, and not only what they need, is how are we best to communicate those messages. So it can be very much more visual stuff, it can be far more arts related. There's a huge focus on really creative expression at the moment that seems to appeal to the students.
I mean, there might be some people who would think, you know, you got a college there, 5,000 students. You know, the fact that they've had to sort of bring you guys in is a sign that things can't be great. But then on the flip side, you could say how great that something which has such a strong relationship and connection with so many people actually values mental health to the extent that they bring you guys in.
Yeah, I mean, I think, you know, no one would wish a mental health crisis on our society or a community, but I think what really marks Hugh Baird out is that common values with Mersey Care for me, in terms of actually seeing a need, thinking creatively, and seeing opportunities to do things differently and better. And I think that's why the two organisations work together so well. You know, there's more than just the mental health element to this for us as well. You know, we can absolutely revitalise the economic circumstances of an entire community by creating vocational and employment pathways for people, so people can be working with the life rooms, gain confidence, skills, become learner ready, and start accessing the vast provision that's in the college already to lead to employment. Now, we know actually all of the evidence proves that having a job that's meaningful and that you value is good for your mental health and well-being. So there's huge opportunities and connectivity between the health and the education sectors to work together. And I think another real advantage to us at Mersey Care is the opportunity for our service users to gain skills, develop, but actually particularly with the Health Education and Training Hub, gain skills around the healthcare professions that we can then recruit back into the NHS so that we benefit from their professional expertise, but also the lived experience people have of a mental health condition. That's got to be better for care.
Walton, Southport, now Bootle. Can it expand further?
Oh, that's definitely the plan. We've got pretty concrete plans already about how we can deliver city centre and South Liverpool. So watch this space and have me back to talk about them.
Absolutely. See, the future of the high street. Everywhere's going to have a life room. That's my prediction. Absolutely.
That's the plan.
Congratulations on the regional award that you've picked up as well. Congratulations as well being put forward for the national award now. It's one of those where even if somebody else wins the national one, you're already kind of a winner,
Yeah.
just being part of the process there. But we wish you all the best. What's the date for the awards ceremony itself?
10th of July at the House of Commons.
Excellent stuff. We'll do enjoy. The House of Commons might look a little bit different then. I don't know where we're up to with all this stuff going on. I think Theresa May will still be the Prime Minister by then, right?
Who knows these days with anything?
This is absolutely true. Congratulations, Michael. Thanks for your time. Michael Crilly from Mersey Care. He is their Director of Social Inclusion and Participation. And the Life Rooms were winners of the Excellence in Mental Health Care Award for the Northwest in an awards event sponsored by the Premier League. It was the NHS Parliamentary Awards. The big winners are on Radio City Talk.
Mental Health Monday with Mick Coyle.
Radio City Talk.